Welcome back, coders. You're watching part 87 of our 100-part CPC exam series. Make sure to like, share, and subscribe to Decode Healthcare with Harshal. Today, we're building a roadmap to master the traps, hierarchies, and modifiers hidden inside the pathology and laboratory section. Let's get right into it. Here's our agenda for today's focused study guide. We're going from an introduction to path and lab into lab panels and bundling traps, cytopathology and cytogenetics rules, surgical pathology specimen levels, and finally, essential modifiers. All right, Section 1, Introduction to Path and Lab, and Section 2, Lab Panels and Bundling Traps. The golden rule for organ and disease-oriented panels is strict. A panel is a defined set of tests. This logic heavily applies to evocative and suppression testing, which measures the dynamic response of endocrine glands. Remember, evocative panel codes cover only the lab assays. Physicians' E&M services and IV administration must be reported separately. Think of a panel like a fast food combo meal. Step 1, check the bag. Step 2, realize that if you're missing the fries, you can't claim the combo. You literally have to bill everything a la carte. If even one required test is missing, code each performed test individually. This leads into a massive compliance trap. Compare these scenarios on screen. It's totally fine to code a separate test alongside a panel if it's not included, like adding magnesium to a basic metabolic panel. But double billing overlapping panels is a huge error. Screenshot these exam traps for your notes. The CPC exam loves tricking you with overbilling scenarios by mixing overlapping panels or trying to make you assume special stains are automatically bundled into surgical pathology. They definitely aren't. Moving right along to Section 3, Cytopathology and Cytogenetics Rules. The core difference here is vital. Cytopathology looks at the physical structure of cells, like fine needle aspiration smears, body fluid cytology, and pap smears using the Bethesda system. Cytogenetics looks much deeper, analyzing chromosomes and DNA through complex studies like karyotyping and FISH testing. When coding non-gen cytology, don't just zero in on the body site. The exam tests whether you caught the specific preparation method in the documentation, like concentration or cell enhancement techniques. Okay, Section 4, Surgical Pathology Specimen Levels. This table is your ultimate cheat sheet for the 88,300 to 88,309 range. Notice how physical size and clinical severity dictate your code. Level 1 is gross exam only, like discarded tissue. Level 2 covers minimal complexity like a skin tag or a vas deferens. Level 3 means low complexity items like a gallbladder or appendix. Level 4 is your standard diagnostic biopsy, like a colon polyp. Level 5 jumps to complex partial organ resections like a prostatectomy. Finally, Level 6 is for radical organ resections for malignancies. Surgical pathology leveling is never guesswork. If a surgeon removes 5 distinct polyps from different regions, you code that level 5 separate times. And always watch out for intraoperative frozen sections. They trigger their own unique coding logic. Let's test your knowledge with a mini mock exam scenario right out of the CPC playbook. A physician removes a simple, benign cervical polyp. Where exactly does that fall on our hierarchy? The answer is 88305. Routine diagnostic biopsies and benign polyps map directly to level 4. To bump it higher, the scenario would usually require a much more extensive or partial organ resection. Down to the home stretch, Section 5, Essential Path and Lab Modifiers. Modifier 26 and TC often appear together when a hospital owns the lab equipment, the technical component, but an independent pathologist provides the interpretation, the professional component. Also, remember Modifier 90. That's used anytime a service is performed by an external reference lab. Now for a heavily tested one. Modifier 91 is strictly for when a clinical diagnostic lab test is repeated on the exact same date to check a patient's changing status. The trap here is clinical necessity. Modifier 91 is strictly for monitoring a changing clinical status, like serial glucose testing. You can never use it if the lab ruined the first specimen or if a machine broke down. Lab errors aren't medical necessity. Grab a screenshot of this visual summary cheat sheet. Keep this roadmap in mind and you'll easily navigate any scenario. But remember, a single bundled panel error doesn't just cost points, it dictates practice revenue. Are your coding habits protecting the clinic or leaving it vulnerable to an audit? Get ready for Part 88 next, where we'll tackle a masterclass on pathology and lab case studies and specimen grading dissections. See you then.